What drug interactions should I know about with antiviral therapy? When you're on antiviral treatment, especially for liver conditions like hepatitis B, hepatitis C, or liver cancer, understanding potential drug interactions is key. These interactions can influence how well your medications work, increase side effects, or sometimes make certain drugs unsafe to take together. Let's explore what you need to know, focusing on liver health and liver cancer. Drug interactions happen when one medication affects how another works. This can mean increasing or decreasing drug levels in your body or adding to side effects. Since the liver processes many medications, if your liver isn't functioning well due to cirrhosis or cancer, these interactions can become more serious. It's especially important to be aware of this if you have liver disease. There are different types of antiviral drugs used for hepatitis and liver cancer. For hepatitis C, direct-acting antivirals like sofosbuvir, ledipasvir, cimaprevir, and daclitazvir are common. These drugs are generally safe but can interact with other medications processed by the same liver enzymes, especially the cytochrome P450 system. For example, some hepatitis C antivirals should not be combined with certain heart medicines, anticonvulsants, or HIV drugs because of the risk of increased side effects or reduced effectiveness. If you are receiving chemotherapy for liver cancer, your doctors will carefully manage these interactions to prevent delays or toxicity. For hepatitis B, oral antivirals like tenofovir disoproxil fumarate, tenofovir alafenamide, and entecavir are often prescribed. These tend to have fewer interactions but still requiring caution. Tenofovir disoproxil fumarate, for instance, can interact with non-steroidal anti-inflammatory drugs, which are common pain relievers. While these interactions are usually mild, your healthcare provider will monitor your kidney function and overall health. Ribavirin, sometimes used with other antivirals, has a long half-life and can stay in your system for weeks after stopping. It doesn't interact much through liver enzymes but can cause side effects like anemia. When combined with other medications, especially in people with liver issues, these side effects need to be watched closely. People with liver disease or liver cancer often take multiple medications, which increases the chance of interactions. Liver impairment can slow down drug metabolism, leading to higher drug levels and more side effects. For example, drugs processed by the enzyme CYP3A may need dose adjustments in advanced liver disease. If you are on both antiviral therapy and cancer treatments, your medical team will coordinate your care carefully. Some antiviral drugs may interact with immunosuppressants like tacrolimus or cyclosporine used after liver transplants or with targeted cancer therapies. In some cases, your antiviral regimen might need to be adjusted to avoid harmful interactions. To stay safe, always tell your healthcare team about every medication, supplement, or over-the-counter drug you're taking. This includes herbal remedies and vitamins. Your doctor or pharmacist can check for interactions using specialized tools and adjust your treatment plan accordingly. If you have liver disease or cancer, your care team should include specialists in liver health and oncology. They will work together to monitor your treatment, manage side effects, and ensure you're getting the best care without unnecessary risks. Remember, antiviral treatments for hepatitis B and C can interact with other drugs, especially those processed by your liver. The risk is higher if you have cirrhosis or liver cancer. Many interactions are manageable with careful planning, but some combinations should be avoided altogether. Always consult your healthcare provider before starting or stopping any medication. Personalized advice is essential because each person's situation is different. Research continues into how antiviral drugs interact with newer cancer treatments. While current evidence supports the safe combination of many antivirals with cancer therapies under medical supervision, ongoing studies may reveal new interactions or safer options. Trust your healthcare team to interpret the latest information for your specific case. In summary, being aware of potential drug interactions with antiviral therapy is vital, especially if you have liver health concerns or liver cancer. With proper monitoring and coordination among your healthcare providers, these risks can be minimized. This way, you can benefit fully from your treatments and support your liver health. Always seek professional medical advice tailored to your individual needs.